Dear viewers, welcome to our new video of GERD treatment with vonoprazan. We are going to discuss about why vonoprazan is superior in the treatment of GERD.
Gastroesophageal reflux disease treatment with vonoprazan. Gastroesophageal reflux disease, GERD, is a prevalent condition characterized by the backflow of stomach acid into the esophagus, leading to uncomfortable symptoms such as heartburn, regurgitation, and chest pain. Managing GERD is crucial to prevent complications and improve the quality of life for individuals affected by this condition. Vonoprazan, a potassium-competitive acid blocker (PCAB), has emerged as a potential treatment option for GERD. Unlike traditional PPIs, vonoprazan offers a unique mechanism of action that results in potent and sustained inhibition of gastric acid secretion. This makes it an attractive choice for patients who might not achieve sufficient relief from their symptoms using other medications. Vonoprazan has emerged as a potential treatment option for GERD. Unlike traditional PPIs, vonoprazan offers a unique mechanism of action that results in potent and sustained inhibition of gastric acid secretion. This makes it an attractive choice for patients who might not achieve sufficient relief from their symptoms using other medications.
Gastroesophageal reflux disease treatment with vonoprazan. The primary mode of action of vonoprazan involves targeting the proton pump responsible for acid production in the stomach. By inhibiting this pump, vonoprazan effectively reduces the production of stomach acid, thereby minimizing the chances of acid reflux into the esophagus. This reduction in acid exposure can alleviate the discomfort and damage caused by GERD, promoting healing of the esophageal lining and reducing symptoms like heartburn. Patients undergoing GERD treatment with vonoprazan should be under the guidance of a qualified medical professional. The appropriate dosage and duration of treatment will be determined based on individual factors such as the severity of the condition, medical history, and response to the medication. Regular follow-up appointments are essential to monitor progress and adjust the treatment plan if necessary. In conclusion, vonoprazan presents a promising avenue for GERD treatment due to its unique mechanism of action and potential to provide effective relief from acid reflux symptoms. Individuals suffering from GERD should work closely with their healthcare providers to explore all available treatment options and determine whether vonoprazan is the right choice for their specific needs. With proper medical guidance, GERD management using vonoprazan can contribute to improved well-being and a better quality of life. You can like, comment and subscribe our YouTube channel. Limitations of PPI for GERD treatment. While proton pump inhibitors, PPIs, are commonly used to treat gastroesophageal reflux disease, GERD, and other acid-related disorders, they do come with certain limitations and considerations. Here are some of the limitations associated with PPIs for GERD treatment.
Partial symptom relief. PPIs are effective in reducing stomach acid production and alleviating symptoms like heartburn, regurgitation, and chest pain. However, they might not completely eliminate symptoms for all individuals. Some people might experience partial relief or continue to have occasional breakthrough symptoms. Delayed onset. PPIs do not provide immediate relief of symptoms. It might take several days for their effects to become fully evident. This could be a limitation for those seeking rapid relief from severe symptoms. Tolerance and reduced efficacy. Long-term use of PPIs can lead to a phenomenon known as tolerance, where the body becomes less responsive to the medication's effects over time. This can result in reduced efficacy and the need for higher doses, which can be concerning due to potential side effects associated with prolonged high-dose use of PPI. Rebound hyperacidity. Discontinuing PPIs abruptly after long-term use can sometimes lead to an increase in stomach acid production, causing a phenomenon known as rebound hyperacidity. This can result in a temporary worsening of symptoms upon stopping the medication. Side effects. PPIs are generally considered safe when used as prescribed, but they can still cause side effects for some individuals. These can include headache, diarrhea, nausea, and, in rare cases, more serious issues like bone fractures and kidney problems. Interactions and absorption issues. PPIs can interact with other medications by affecting their absorption or metabolism. For instance, they might reduce the absorption of certain nutrients like calcium, magnesium, and vitamin B12. Underlying causes. PPIs primarily address the symptoms of GERD by reducing acid production. However, they might not address underlying factors that contribute to GERD, such as hiatal hernias or certain dietary triggers. Overuse and inappropriate use. PPIs are sometimes prescribed unnecessarily or for longer durations than needed. This overuse can expose individuals to potential risks and side effects without clear benefit. Long-term risks. There have been concerns about potential long-term risks associated with prolonged PPI use, such as an increased risk of certain infections, kidney disease, and fractures. However, the magnitude of these risks and their causality is still a topic of ongoing research and discussion.
It's important to note that the limitations of PPIs can vary from person to person. For some individuals, PPIs might be highly effective and well tolerated, while for others, alternative treatments or approaches might be more suitable. Now we will discuss about superiorities of Vonoprazan. Superiorities of Vonoprazan for GERD treatment. Vonoprazan, a relatively newer medication for the treatment of gastroesophageal reflux disease, GERD, has shown several potential superiorities when compared to traditional proton pump inhibitors, PPIs. Here are some of the reported advantages of Vonoprazan for GERD treatment. Faster onset of action. Vonoprazan has been reported to have a quicker onset of action compared to traditional PPIs. This means that it might provide faster relief from GERD symptoms such as heartburn and acid reflux. Potent and sustained acid suppression. Vonoprazan is known for its potent and sustained inhibition of stomach acid production. It effectively blocks acid production by binding to the proton pump for a longer period compared to some traditional PPIs. This can result in better control of acid reflux symptoms. Effective in refractory cases. Some individuals with GERD do not respond well to traditional PPI therapy. Vonoprazan has been shown to be effective even in cases where patients did not experience adequate relief with standard PPIs. This makes it a potential option for those who are resistant to or have difficulty tolerating other treatment. Nighttime symptom relief. Nighttime GERD symptoms can be particularly troublesome for some patients. Vonoprazan's extended duration of action could potentially provide better relief for nocturnal acid reflux symptoms. Reduction in meal timing restrictions. Traditional PPIs often require specific meal timing, as they need to be taken before meals. Vonoprazan is less influenced by meal timing, making it more convenient for patients. Less affected by CYP2C19 variability. Some individuals have genetic variations that affect how they metabolize certain medications, including PPIs. Vonoprazan's metabolism is less influenced by these genetic variations, which can lead to more predictable and consistent treatment outcomes. Lower risk of rebound hyperacidity. Discontinuing PPIs can sometimes lead to a temporary increase in stomach acid production, causing rebound hyperacidity. Vonoprazan might have a lower risk of this rebound effect due to its longer duration of action. Potential for improved treatment adherence. The convenience of less strict meal timing and potentially longer-lasting effects might improve treatment adherence among patients, leading to more consistent symptom control. It's important to note that while vonoprazan appears it is most up-to-date preparation for GERD treatment options, including the potential benefits and risks of using vonoprazan. The U.S. FDA approval of vonoprazan. The U.S. Food and Drug Administration, FDA, approved Phathom Pharmaceuticals' Vonoprazan, voquenza, on November 1, 2023 for the treatment of adults with erosive esophagitis, erosive GERD, a gastroesophageal reflux disease. The drug is expected to be commercially available by December 2023. What is the drug for? Voquezna Triple Pak is a co-packaged product containing vonoprazan, a potassium-competitive acid blocker, PCAB, amoxicillin, a penicillin-class antibacterial, and clarithromycin, a macrolide antimicrobial indicated for the treatment of Helicobacter pylori, H. pylori, infection in adults. Voquezna Dual Pak is a co-packaged product containing vonoprazan, a PCAB and amoxicillin, a penicillin-class antibacterial indicated for the treatment of H. pylori infection in adults. How is this drug used? Voquezna Triple Pak is an oral medicine, tablets and capsules, that can be taken as the following dosing regimen, as written by your doctor. Vonoprazan 20 mg plus amoxicillin 1000 mg plus clarithromycin 500 mg, each given twice daily, in the morning and evening, 12 hours apart, with or without food, for 14 days. Voquezna Dual Pak is an oral medicine, tablets and capsules, that can be taken as the following dosing regimen, as written by your doctor. Vonoprazan 20 mg twice daily, morning and evening, plus amoxicillin 1000 mg, 3 times a day, morning, midday, and evening, with or without food, for 14 days. Who participated in the clinical trials? The FDA approved Voquezna Triple Pak and Voquezna Dual Pak based efficacy and safety on evidence from a clinical trial of 992 adult patients with H. pylori infection. The trial was conducted at 103 of sites in the United States, United Kingdom, Bulgaria, Czech Republic, Hungary and Poland.